A targeted therapy for leukemia, initially approved by the FDA, later had that approval withdrawn after testing showed increased mortality. It's called Mylotarg. After extensive genetic testing, it is now back on the market with new dosing and a specific target. Ursula Perry reports on the amazing turnaround that's now saving lives.
When doctors told Michelle Yim-Karpan she had AML, a form of leukemia, she knew only 27% of patients live 5 years after this diagnosis. Chemo treatments had her in and out of remission. Then in 2014, she was able to get Mylotarg and has been disease-free ever since.
It gives you a lot of hope. It gives you a lot of hope because when you originally read the stats for AML, the stats are not very good.
Dr. Erwin Bernstein developed the antibody that delivered a highly toxic drug to the protein CD33, which is found on leukemia cells. He watched it get a rapid FDA approval, then be taken off the market 10 years later.
We were convinced it really worked, and it was probably a matter of time. And it was a matter of the economics from the companies, something that we can't control, but fortunately, the data was good enough and it came back.
Researchers like Sohel Mashini say the breakthrough involved picking more appropriate patients, like Michelle, whose tumors express the CD33 antigen. This means that the protein of interest is present in the tumor.
If it's not expressed, there's no place for Mylotarg to bind to, thus no effect.
Dr. Mashinshi says patients with higher CD33 positive AML are showing a 35 to 40% increase in survival.
As for many other targeted drugs, we're learning how to use this better and better, and we'll give it to the right people and anticipate more effective results.
It's allowing Michelle to look ahead with more confidence. Ursula Perry, KSAT 12 News.
Mylotarg is approved for kids as young as 2 years old. It's given along with standard chemotherapy drugs, usually after most leukemia cells have been cleared from the bloodstream.